Hello, and welcome to Health Matters, a program brought to you by the Farmington Valley Health District. My name is Jamie Dujak, the FVHD Community Health Associate, and today I am joined by Olivia Morris and Justine Ginsberg, my colleagues, and I'm your host for this episode. As your local health department, we ensure conditions in which we all can be healthy and thrive. Today, for this episode, we'll be talking about our Community Health Improvement Plan. That is a 5-year strategy for us and community partners to really think about the conditions in which our communities are able to be healthy and how we can achieve those goals. So, without further ado, I'm going to have my guests introduce themselves. So Olivia, let's start with you. What is your role at FVHD, and what was your role in the CHIP as we did the Community Health Improvement Plan?
Sure. So I'm the epidemiologist at the Farmington Valley Health District, and in this role, I monitor trends in diseases, illnesses, and injuries in our communities, included but not limited to respiratory illnesses, opioid overdoses, foodborne and waterborne outbreaks. And the purpose of this is to maintain a situational awareness of what is occurring in our community to allow us to be prepared to respond and ultimately to maintain healthy conditions in our community. I also stay up to date on what's happening at a national level and at a state level with new and emerging illnesses like measles and avian influenza this past year to ensure that our health district is prepared should anything occur here. So that's the day-to-day, but in terms of the Community Health Improvement Plan, I was primarily involved in the beginning stages in writing and developing our community health assessment, which we'll discuss more in a little bit, but that laid the groundwork for the Community Health Improvement Plan.
Thank you. I'm so happy to have you both here with me and doing this. This is fun. So Justine, let's move to you. What is your role at FVHD, and what was your involvement like with the CHIP?
Okay, so I'm very fortunate to be the community health coordinator for the Farmington Valley Health District. So I get to work with these amazing human beings who have added so much depth to the programs that we're able to produce. So my primary role is really taking a lot of the data and the information that Olivia is able to find and look at the national trends and look at the local trends and really translate that into programming and outreach in our communities. I'm also the community health educator, so I have the enjoyable task of being able to write a lot of hopefully really good programming that myself and Jamie are able to deliver into the Farmington Valley Health District, and recognizing that really if we look at health in humans, it's cradle to grave. So our platform is large. So from the moment you're born until the moment you leave this world, you have there's some role for us to play in helping to help make you healthier and live hopefully a longer and happier life. And from the perspective of the Community Health Improvement Plan, after Olivia did the community health assessment, part of my role was helping to translate that into actionable steps with our panel of experts that we were able to gather that I think we're going to talk about shortly, and really prioritizing working in the mental health section, which is what I've been doing for the last few years. Obviously after the pandemic, things changed a little.
Just a little.
Just a little.
Just a little. So, I mean, obviously, we do a lot of work at the Farmington Valley Health District.
We do. It's varied.
It's very varied. It spans, like you said, cradle to grave. Mm-hmm. And so I want us to think about, as we do Health Matters and as we go through the episode, oftentimes we hear that public health is invisible, but it's not. It's really visible and it's everywhere. So as we talk about our Community Health Improvement Plan, let's keep that in mind. So, we've been throwing a lot of acronyms at the viewer, you, and so I want to just go into a little bit of a deep dive as to what the Community Health Improvement Plan is and how we got here. So, the Community Health Improvement Plan, also known as our CHIP, you'll hear us call it the CHIP here and there because it's just way easier to say. And then we have the Community Health Assessment. So Olivia talked about it a little as well as Justine, and so that is what we call our CHA. And so that really is a precursor as to what the community health improvement plan is. So in the community health assessment, we use local data, we use community input, subject matter expertise to really understand where we are in the Farmington Valley Health District, what conditions exist, and what the health is like of our community members. And so we use that data to really identify some priorities. And then we go into our community health improvement plan, which is a 5-year plan in which we work with community members, community partners, and ourselves to really further the goals that we came up with in the plan, as well as through our assessment. So Olivia being here she was a huge proponent in doing the community health assessment. So Olivia, do you want to talk to us a little bit about what that process looked like?
Sure, I'd love to. So this was a very exciting project for the Farmington Valley Health District, as this was our first ever comprehensive CHA that was done. So as Jamie just said, a CHA in general is a collaborative, data-driven report on the health status of a community. So that's what it is in general. In terms of our process in the Farmington Valley, we first convened a coalition of local subject matter experts and community members, and they guided this work. And then in actually writing the report, it was 2 parts. The first part involved pulling data from a variety of sources on a variety of data indicators. So we looked at things like the census. We looked at the Behavioral Risk Factor Surveillance System, which is an annual survey done by the CDC that many of you may have been called about. We also looked at the Connecticut School Health Survey, which is a survey of high schoolers. And that's just a preview of what we looked at. And then in terms of the actual data we looked at health behaviors. So things like how often people are exercising, how, like, their eating habits, healthy eating habits, a bunch of things. And then we also looked at health outcomes. So how many people are living with chronic diseases in our community, cancer, heart disease. We looked at infectious diseases. So how many people got the flu in the past year or were infected with a foodborne pathogen. And then we also looked at the leading causes of death in our community. So that was one part. And then the second part is we had a series of focus groups with the directors of the social services in all of our towns to better understand the health challenges and health status of more vulnerable members of our community. And so those 2 things put together, we analyzed the survey data, the focus group data into, ultimately it's a written report. It's about 80 pages, available on our website for anyone that is interested. The full report is there, as well as a summary document. And so this ultimately showed that the Farmington Valley has many strengths in terms of health status and health outcomes, but certainly it still showed a few areas where focus is needed. 3 in particular are healthy eating and active living, mental health, and the health of the aging population. And these 3 focus areas became the basis of our CHIP.
Beautiful. Thank you so much. Lots of stuff. I mean, an 80-page document, which is beautiful, a beautiful document. The summary document is amazing. I highly recommend checking it out because it really gives us an idea as to what we're really thinking about in the Farmington Valley Health District. We're consisted of 10 towns. So it's, a good look at, what is going on. And I like that you talked about there's a need for qualitative data, so data that is numbers, and then there's a huge need for quantitative.
Other way around.
That's fine. Quantitative data, numbers. And I like that you say that there's quantitative data and qualitative data. So quantitative, we think of numbers, right? Quantities. And, as public health people, anyone who works with numbers, we love that, right? But it's so important to have qualitative data because it really gives us an understanding as to what's really happening. The numbers can only tell us so much, right? And so the focus groups really helped us there.
And I think the other thing I just wanted to add after listening to Olivia describe, what she she contributed in that community health assessment is for folks at home, this was nearly a year's worth of work. And just to help to set the ground for people at home who maybe don't understand how health departments work, where in order for me to do my job as a community health coordinator, I have to be able to look at data and see where we sit compared to the rest of the nation, compared to the rest of the state. So the work that Olivia did was not just looking at our health data, it was looking at where we sit in the trends, emerging trends, compared to the rest of Connecticut and compared to the rest of the United States. So, you know, we're very fortunate here in the Farmington Valley. We have many great resources, and a lot of our community members are very fortunate to be able to have access to a lot of health resources and educational resources. But there are some gaps, and this allows us as a health department to really hone in on where are we lagging behind the state data or the national data, and how do we really improve that so that our 10 towns of the Farmington Valley have the best possible chances. And that's what public health is, and it's often in those little intricacies that we find opportunity to be able to really improve the lifestyle of those that live in our towns.
Yeah, for sure. So Olivia and Justine ended on talking about our priorities. So we have healthy eating and active living, also known as HEAL, mental health, of course, and then optimal well-being for older adults, which we also tend to call THRIVE. And so we're going to go through each of them to really just give a basis as to what the strategies and goals kind of looked like. So healthy eating and active living, we'll start there. Obviously, one of the biggest, prevention measures to chronic disease is eating healthy, eating nutritious, and being physically active. We know that. The issue is that there's a lot of barriers to those things. And so it is a management sort of thing. We're managing those things so we live healthier lives. But we don't always live in places, we're not always in environments where that can be done. Right. And so in our community health improvement plan and our community health needs assessment, we kind of realize that that is the case. You know, we can tell people to do individual behaviors. We can give you the information that you need to eat healthy and exercise right and what the CDC recommends. But the reality is we really need to focus on a systemic level. And so right here, we're really thinking about what are the resources that exist that people can use to be physically active. So we're working with community partners such as our parks, such as the YMCA, places like that, individual businesses, social services agencies. So a lot of work going into really changing the landscape and making it way easier to be healthy and to do HEAL, right? Healthy eating and active living. So thinking about systemically how that happens. And then understanding that food is a huge part of that as well. And as we see, the landscape of food changing with processes, whether something's fresh and raw or ultra processed, we're getting more information as to what that looks like. And we're also understanding more how our environments can really shape the way we eat. So we think of school lunches for kids, right? If you are a school-age child, a lot of your meals come from school. And so how can we, as a community, really impact those things to ensure that the kids are getting the nutrition they need to be healthy and to really carry out their days, right? Our food not only impacts just our physical health, but as well as our mental health.
Jamie, when you say that, I think about a lot of the conversations we have as a team. And when we talk about the importance of, public health that is actionable, like how do we make health actionable? It's wonderful to have the data, and the data drives a lot of the decisions that we make, but we need to make this actionable so the folks at home are able to see it. It's wonderful, and it's vitally important that we have policies that support the choices that we make, that help to shape our environments, that help to shape our communities. But then it's taking that policy and making it something that mum and dad at home can actually do something about. And a lot of the work that we do is that translation piece, is how do we make it the easiest choice? The safest choice, the easiest choice, the most available choice.
It's all about accessibility.
Yeah, and equity. Like, how do we make sure that whether you're living in Barkhamsted, which is often a more rural population, to whether you're living in the heart of Simsbury, because we're being filmed in Simsbury TV today, you know, that you should have the same ability to access the resources that you need to live a healthy, happy life.
For sure. So, and then maybe that is a lot of high-level stuff. So one of the specific goals we have is introducing workplace wellness programs into businesses within our district. So really infiltrating those spaces, right? Because we do a lot with kids, we do a lot with older adults, but really working in the workplace, because that's where us as adults usually spend most of our time. So, you know, thinking about policies, thinking about what health education we can do in those spaces, that's really kind of an example of what is happening in the HEAL side of our community health improvement plan. So, next priority area, mental health.
Oh boy, that's a big one.
And it's been a big one, right? We've been doing mental health programming at the Farmington Valley Health District for 15 years.
Yeah, long time.
And the landscape keeps changing, right? The environment keeps changing, and Justine and the rest of the community health improvement team, community health team really have to stay on our toes. You know, we have to be aware of what's happening. So, Justine, would you want to talk to us a little bit about the mental health side?
As Jamie, who is often my partner in crime, you'll see her and myself often out in the community teaching and talking mental health. I think the biggest common denominator in anything we do in health-related activities is mental health. You can't change any health behavior. You can't do anything in a community that shifts that needle towards a better way of living, a healthier choice, if we don't understand why we make the choices we make or why we do the things we make. What are the barriers and what are the challenges? So the mental health piece as a nurse, which was my former career, you can't work with a human being to change anything if you don't understand the motives. So mental health touches every part of the community health improvement plan. From the HEAL, looking at how we eat, where we eat, why we eat, where we exercise, why we don't exercise, what are the barriers, do we feel safe, do we feel bored, do we feel challenged, do we not feel challenged, to the primarily mental health piece, which is how do our brains work, how are we able to live our best and healthiest lives, how can we reduce the chances of severe mental illness, how do we deal with mental illness when it occurs, and really looking at that primary prevention curve, which is if we can nip a problem early in the piece, whether it be from a mental health perspective or a physical perspective, we can do so much more to change it. And public health is about prevention. So much of what we do is how do we set the circumstances in our schools, in our churches, in our towns, in our workplaces, where we're aware of each other's emotional needs, our mental health needs, and we can be preventative, and if not preventative, at least we can early identify when there are challenges and rectify them as quickly as possible. So that infiltrates, again, every piece of what we do as public health professionals. And then when we look at our senior population, which is that Thrive piece, you know, the older we get, the more challenges we can actually have from a mental health perspective. And you think about in the UK about 10 years ago, they actually declared a public health emergency for our elderly with an epidemic of loneliness. They actually created a government minister that's primary job was to look after loneliness. We have that same problem here in the United States. Our Surgeon General just 2 years ago called the same epidemic of loneliness. So a lot of what we do at the Farmington Valley is how do we connect those pieces? So from the mental health perspective, it really is looking at how do our businesses run, how do our schools work, our daycare centers, our churches, our community partners. How are we all talking mental health, reducing stigma, increasing mental health literacy, increasing access, early access to services, so people don't feel bamboozled by the system. They can actually be their own advocates. And that's a lot of the work that we're doing in the mental health. It sounds like an awful lot, and it is.
It is. And it's very noble. It's not an easy sphere to enter, you know, given the challenges and barriers that everyone faces when it comes to mental health, especially working with a health system.
Totally.
So,
So, example of some of the mental health programming and work that we're already doing is the mental health first aid programs that we do in our schools. And I think viewers of this, our avid viewers who follow everything we do on Health Matters, will have watched our previous episode where we were interviewing the Granby school system, looking at mental health first aid being taught throughout the entire school for the staff. The entire high school student population have all been trained. That's a really tangible, measurable achievement for our mental health aspect of our community health improvement plan. And we're planning on bringing that to all of our 10 schools, so stay tuned to a station near you. But that's just one example, working with our businesses to create spaces where our businesses have mental health literacy. They understand that everyone has the right to have a bad day. Everyone has the right to not be okay. And not being okay today doesn't mean you're not going to be okay tomorrow. It's creating space for grace. Working with our churches, helping to train our churches, our church leaders in QPR suicide prevention training, so that we're able to really understand how to have these really difficult conversations in the calmest and most supportive way. We do a lot of Narcan training, which is really looking at that high-end harm reduction piece. If we can't prevent something and we can't nip it in the bud early, how do we reduce the potential of harm? So things like Narcan training and suicide prevention training really look at and understand the importance of gearing up our community so they can respond to those emergencies, and they can do so with knowledge and a feeling of competence. Working with our towns to create the CLEAR team and the CLEAR team that are out there working with our police force, really trying to be able to help people who are struggling with substance misuse to be able to access treatment early and without prejudice. Yeah. So, there's a lot that we're doing that supports our community from a mental health perspective.
For sure. And you list all the community partners we work with, right? Yeah. The list goes on: faith-based, schools, law enforcement, businesses, on and on and on and on. And I just wanted to point out that this plan, this document wasn't built for us, right? It was built for the whole community. And we know that this work is already being done in different, spaces. So how can we be a convener, right? How can we bring the community organizations together to, the more the merrier, right? The more resources we have, the greater the impact can be. So really just tying us all together, because often we get a little separate, naturally. So Justine, you talked a little bit about our older adults, and so that segues us into talking about thrive and thriving and having optimal well-being as older adults. So what have we done with that? Sure.
So Jamie, we're very fortunate that our senior population are living longer, healthier, more independent lives already. What a win for public health in the long term and the short term. But with that brings additional challenges. We're living longer, and because we're living longer, we're also more at risk of chronic diseases, because the longer you live, the bigger the chance that the older you get, our bodies start to get tired and start to break down a little, and we become more vulnerable to some of those chronic diseases. So we do a lot of work at the Farmington Valley looking at how can we keep our senior population living happily, independently in their own home for as long as we possibly can. Some of that work involves some of the programming we already have, like the Matter of Balance program that helps to reduce the risk of our seniors falling at home. We've got some amazing initiatives again here in Simsbury with the
Steps to
Safety. My brain stopped for a short moment. That's why we have an amazing team. And Steps to Safety really is this amazing amalgamation of multiple town-based resources. So it brings in the emergency responders, so the police and the ambulance, our senior centre and our senior centre directors. It brings in our fire department that go into homes and do amazing surveillance of what are the full risks in a person's home if they've had a series of falls. How can we reduce the risks of them falling again, reduce the impact to their health long term, and keep them living safely and independently at home? So there are a couple of examples of what we're already doing, but it's really Thrive is looking at how do we keep our seniors not just healthy and at home, but happy and engaged. We talked about that epidemic of loneliness. How do we keep our seniors engaged in our community, working with the younger generation? How do we capture this amazing lifetime of knowledge and honour that, and not in a way that we sort of put them in a corner to play a puzzle quietly, but how do we bring them out into our community so all of us can benefit from their knowledge and their life's experience. So we have a dynamic Thrive group who are very enthusiastic and are out to change the world, and so they should.
Yeah. And all of these, all of our priorities, as we developed the trip, we had separate work groups for each one, and full of very passionate community members,
Very much so.
subject matter experts, ourselves, and so using their experiences to really shape this document is what has made it so beautiful and has made it a living document. So, with our community health assessment, like we said, we talked about identifying those 3 health priorities, right? Heal, mental health, and optimal well-being for older adults, or Thrive. As we were making the community health improvement plan, we kind of got to thinking that there was something we were missing here. And so we kind of got to the point where we figured we needed to do something to talk about addressing emerging environmental health concerns. So that is our 4th priority area. Olivia, do you want to talk to us a little bit about that?
Sure. So this is definitely a new area in general for public health, and certainly for the Farmington Valley Health District. Looking, I think a fancy way of saying emerging environmental health issues is a fancy way of saying climate change. And I think, right now we're living through a heat wave here in Simsbury, and think about the effects of that on people who work outside or people who don't have AC, air conditioning. That's here in our local community. More, nationwide is flooding, like what unfortunately just happened in Texas. Certainly the loss of life. But beyond that now, they've had boil water advisories because the water's not safe to drink. So it's becoming more and more regular in occurrence. And so at the Farmington Valley Health District, how we're entering this is first just trying to understand what data is out, or what indicators are out there to help us measure the impact of climate change on public health and on human health. So that's a big focus for us. And then certainly going along with this is communicating this and messaging this to the public. So that's, I think, one big component of our focus in this focus area. And then the other is to continue the work that our environmental health team does every single day to continue to enforce laws that support good environments, that support good health.
I also think when we're talking about environment, every time we talk about things getting warmer and maybe our winters not being as cold, and we all know that because we don't get snow days and you're not outside nearly as much, is vector-borne illness. I mean, you think about that tick life cycle. We rely on a very cold winter to kill off those ticks before we have the next summer influx. And I mean, I'm not sure about you guys, but we were getting ticks all the way through winter. On our dogs, we had ticks inside all the way through winter. You look at mosquitoes and mosquito-borne illnesses. I mean, the sort of things that Olivia is constantly tracking. We're seeing that because of some of the climatic changes and the deviances from what we normally see. So, people often think, how does that affect me? It doesn't flood at my house.
Right.
But you got ticks, though.
Yeah, that's a really good example.
Yeah. It's funny because that was exactly what I was going to bring up, the mosquitoes, right? We tend to say, oh, it's never been this bad with mosquitoes. I can't even be outside of my house after dusk. There's a reason why, right? It gets, the warmer winters are, the more water we have, the greater ability for mosquitoes to really thrive and breed. So we're seeing the effects of that, and we're seeing it in our breeding holes for mosquitoes, triple E, right? So, that being said, huge list of things that we have on our plate.
We're not very busy at the Farmington Valley.
But we did the community health improvement plan. We published the document, but it is a living document. Things will change the more we work with our work groups, the things that emerge as we see nationally, locally, statewide. And so we're really not rigid with this. This can change. And so the next steps right now are really looking at the work that we have done thus far, seeing what's relevant, what we missed, what changes need to be made, going back to our work groups and thinking about that, and tapping into our community. So if you have interest, the viewer, in our community health improvement plan and getting involved with us at the Farmington Valley Health District, you are more than welcome to. We need your voice to really understand what's going on and what's important to our community. So you can go onto our website, which is fvhd.org. Go into the community health tab and you'll see everything. You can give us a call. Our phone number's on the website. And we look forward to hearing from you all. Thank you both, Olivia and Justine, for being here with me. This was a lot of fun.
It was.
Till next time, huh?
Till next time. And so before we see you next time, remember that your health is your greatest wealth. Thank you. Bye.
For over 40 years, SCM
has been the voice of our town,
bringing us together through local programming,
education,
and live broadcasts.
SEM isn't just about television.
It's about empowering our community,
ensuring our voices are heard during government meetings,
and celebrating milestones
like our high school graduations.
But today, SEM faces a challenge.
Our funding structure is based on television subscriptions.
And it's no secret, people have been cutting the cord.
With a shift to internet-only subscriptions,
SEM receives less revenue,
even though all our programming is freely available online.
We need your support.
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 Your donation can make a difference.
It will ensure that SCM remains open,
continues to educate our youth,
and keeps our community informed.
Thanks to SEM, I've been honing my creative skills, helping me work towards my college degree.
SCM is crucial for keeping our community connected.
SCM isn't just here to broadcast local events. They're actually preserving Simsbury's history.
Join us
in preserving Simsbury's voice.
Simsbury's voice.
Together we can ensure that SCM continues to thrive
for generations to come.
Visit our website
Or scan the QR code on your screen to make your donation.
Every contribution
counts.
Thank you for supporting Simsbury Community Media,
where your town,
Your schools,
And your government
come together.